The World Health Organization says more than a dozen hospitals in Gaza are no longer operating because of direct attacks and lack of fuel. And the ones that are overcrowded, understaffed, and dealing with severe shortages of anesthesia or even something as simple as clean water. For more, let me turn to Dr. Gilbert, a Norwegian physician specializing in anesthesiology and emergency medicine. He helped provide emergency trauma care in Gaza for more than 4 decades. Dr. Gilbert, thank you for being on the program. We are hearing horrific tales of what's happening in these Gaza hospitals who need so much and they simply don't have something as simple as clean water, anesthesia. Sometimes the doctors and nurses have to make very difficult life and death decisions for their patients. Tell me what you're hearing.
Well, this is precisely what I'm hearing from my colleagues in the various hospitals in Gaza. They are lacking the most basic provisions to give the needed treatment and care for not only the war wounded, but also the other ordinary patients coming in to the hospital. And the most basic needs now is actually electricity, it's water, it's food, and it is, of course, basic medical equipment like disposables and drugs. But it has been so difficult to run the hospitals that they have been at the brink of collapsing. But I'd like to underline that the medical staff in these hospitals, the Palestinian doctors and nurses and paramedics, they are doing a heroic job. And they're standing by their patients despite all these difficulties. There is almost no space left on the floor to find a bed, let alone a stretcher, let alone some hardcore material on the floor to treat the wounded. The most imminent need now is to have fuel for the generators. It is to have water for the patients, for the staff, and for the 122,000 internally displaced that have been seeking refuge in the hospitals. Shifa Hospital, the largest one, where I've been working for the last 20 years, they had to shut down a number of generators, and they had to shut down both the sterilization unit, the unit which is cooling down the storage for the killed ones, and also they had to shut down multiple machines that are producing oxygen for the hospital. And on top of this, they have this constant threat of being bombed. All the 14 hospitals in northern Gaza have been given orders by the Israeli occupation forces to evacuate patients and staff because they're going to be targeted. And the last 24 hours, 7 hospitals were targeted, 13 were killed, and 130 injured. And these were hospitals for children, for cancer patients, and for psychiatric patients.
Let me ask you a question about the Shifa Hospital, which you also know this hospital really well. I know you're aware that the Israeli military says that's where Hamas is running its command and control center. On all the years you were there, did you see any kind of suspicious activity? And I mean, what do you think about what the Israelis are saying?
I think they are liars. They're lying about so many things. And listen, we heard these claims about Shifa Hospital being a Hamas control center or a control center for the resistance. First time in 2006 and 2009. We were even threatened to have to leave the hospital because the Israelis were going to bomb it. We heard the same claims in 2014 and now again. So, you know, it's been 16 years and I haven't seen a single proof of this command center. Maybe it's there. I've been walking freely all over the hospital. I've taken pictures, I've video filmed, I've talked to people, I'd opened any door I like to open, and I haven't seen any center, nor have I seen any of the well-known faces of the leadership of the resistance. So, no, we have no proof of that. It has been 16 years. The Israeli intelligence, as we all know, is very strong. And I urge them to put the proof on the table.
Well, Dr. Gilbert, we're running out of time, and I really want to get to this. As you know, UN is calling the situation in Gaza a graveyard for children. I know you've been trying to get yourself into Gaza. Are you still planning to go, and will they let you in?
Absolutely. We are still planning to go, and there are hundreds of medical professionals from all over the world who are insisting to go to Gaza. But the Israeli siege of Gaza is complete. The amount of help coming in with the trucks is ridiculously low. And the medical staff and relief teams are not allowed in. So this is a slow motion mass murder. And the wounded and the civilians are starved and thirsted until they are going to die. So this is a massacre of a dimension that we haven't seen for, I would say, centuries. So this has to stop. We have to protect the civilians, get in the medical supplies, turn on the light, turn on the water, and stop the bombing. That's my medical receipt.
We're going to have to leave it there. We certainly appreciate your take, Dr. Mads Gilbert, joining us from Amman.